look at the latest data on the spread of the coronavirus pandemic here in the United States tells us there are now north of 1,100,000 confirmed infections spread out across the country. More than 34,000 of those cases were added in the last 24 hours since just yesterday morning. On that note, welcome to America's News Headquarters from Washington, D.C. We'll keep you updated on the latest stats all afternoon long. It's great to be with you at home. Leland, it's great to be with you. I'm Jillian Turner.
Jillian, nice to be with you as well. I'm Leland Vittert. The Trump administration is, of course, working to contain the coronavirus here at home, but there's a newly leaked dossier that might shed light into where and how this virus first began. Mark Meredith at the White House, where they are keeping a close eye on this, as the president's at Camp David. Hi, Mark.
Leland, good afternoon. As you mentioned, President Trump is spending the weekend at Camp David, but here in Washington, the investigation into the origins of the coronavirus continues. A senior intelligence official tells Fox's chief White House correspondent John Roberts that right now most U.S. intelligence agencies believe the virus originated in a Chinese lab and that its release was an accident, not intentional. The president this week said he could not go into detail about the intelligence that has been gathered so far, although the president was asked on Friday, right before he left for Camp David, if China could face additional economic issues over this crisis.
A lot of things are happening with respect to China. We're not happy, obviously, with what happened. This is a bad situation all over the world, 182 countries. But we'll be having a lot to say about that. It's certainly an option. It's certainly an option, Judge.
Now, before he left for Camp David, the president welcomed the head of Gilead Sciences to the Oval Office. The FDA granting emergency use of the company's drug remdesivir to treat COVID-19 patients. Clinical trials have shown the drug shortens the recovery time for some patients.
For those of us who have worked in viral diseases and pandemics for a long time, this is our first really positive step forward.
Now, the Senate is expected to return next week. The House has postponed its plans to return. House Democrats, though, had hoped to get Dr. Anthony Fauci to testify before a committee. The White House, though, is not going to let that happen. We heard a statement from a White House official on Friday writing, quote, while the Trump administration continues its whole-of-government approach response to COVID-19, including safely opening up America again and expediting vaccine development, it is counterproductive to have the very individuals involved in those efforts appearing at congressional hearings. However, Fauci is expected to head up to Capitol Hill later on this month. He's scheduled to testify for the Senate in mid-May, so we'll be watching that as that develops. Also want to mention, Leland, right now we just had the flyby here over the White House a few moments ago. Pretty amazing sight to see, as I'm sure you've been showing those pictures all morning long. Leland?
Yeah, we have the Thunderbirds and Blue Angels making their way down from Baltimore, and we could hear the roar over the White House. Mark, thanks so much.
You bet.
Jillian?
Well, a look at the weekly jobless number shows us that 30 million Americans have filed for unemployment benefits since just mid-March. We're now looking ahead to next week, anticipating the release of April's unemployment report. Garrett Tenney takes a look at that. He'll tell us what the numbers say about what to expect coming up next week. Garrett?
Yeah, well, Jillian, administration officials are projecting that this next week's report could be one of the worst we have seen since the Great Depression. Last week alone, 3.8 million Americans filed jobless claims. That is adding to the 6-week total, pushing it to more than 30 million, according to the Labor Department. This morning, White House economist Kevin Hassett painted a bleak picture of the nation's short-term economic outlook, predicting next week's job report will show an unemployment rate between 16 and 19%.
You're going to see some economic data over the next few months that's as bad as you've ever seen. You know, we turned the economy completely off, which is something that just hasn't ever happened before. And so you are going to see a very big increase in the unemployment rate, a very big decline, as Larry Kudlow mentioned, in second quarter GDP. But most forecasters expect the second half can rebound from that. And the sooner we get going, the more likely it is that that'll be true.
This next week, at least 20 states will start the process of easing restrictions and reopening their economies. Officials across the board will be keeping a close eye on the economic impact those moves have, as well as the impact on public health, with concerns that some states are opening too quickly and could cause the number of coronavirus cases to surge once again. Despite the bashing our economy has taken during this pandemic, Labor Secretary Eugene Scalia believes it can make a quick turnaround.
I think that our economy has a chance as we reopen now to get back to where it was. You know, we were so strong a couple of months ago. We had to take this pause. But I think as we begin getting back, people are going to be pleased to be back at work and get that economy going again.
This next week, we'll get an even clearer picture of the impact the coronavirus has had on our economy. Is more than a dozen major corporations are scheduled to release their first quarter earnings. And again, officials are saying those numbers are expected to be very bleak. Jillian?
Garrett, thanks for that. Leland?
All right. States have also been hard hit by the coronavirus, especially when it comes to their budgets. Tax revenues just are not coming in, creating massive budget shortfalls. Joining us now, Republican Colorado Senator, member of the Senate Foreign Relations Committee, Cory Gardner, who I believe, sir, has made it back to Yuma, Colorado after being in quarantine the last time we talked. We're glad to see you, sir.
Thanks, Leland.
Let's begin here. Front page of the Denver Post today. $228.7 million cut from the Colorado state budget. That's just the beginning. That translates into job losses, programs that don't happen, etc. Should the federal government be in the business of making up those shortfalls to the states?
Well, of course, it depends on what that expenses are. What those expenses are that the federal government's going to be asked to reimburse. When it comes to COVID-19 related expenses, certainly the federal government should work with the states to help cover the costs that they're going to have. That's why I support additional COVID-19 related help to the states. Senator Bennett, Governor Polis, and I have sent a letter to both McConnell and Schumer and Secretary Mnuchin asking for additional help to states and local governments. Look, we're not going to be paying for trips to Antarctica over bad decisions, but I do think there is going to be a need for aid to states to help cover the expenses, whether it's the fire department, the EMTs, or others as it relates. So
there's two issues here. There's the direct cost of COVID-19, as you pointed out, fire departments, hospitals, et cetera. And then there's the lost tax revenue. And certainly Colorado has gotten a lot of lost tax revenue. Ski resorts shut down during a busy part of the time, year, et cetera. This letter sent by Rick Scott, among others of your Republican colleagues, to the president. We urge you, meaning the president, to reject efforts by some states to use federal tax dollars for reasons unrelated to combating coronavirus. We believe additional money sent to the states for, quote, lost revenue or without appropriate safeguards will be used to bail out unfunded pensions, reward decades of state mismanagement, incentivize states to become more reliant on federal taxpayers. As I understand it, you are not a signatory to that letter. Why not?
Well, look, I have faith in Colorado. I believe in Colorado. I believe we'll do the right thing with those dollars, and we can write laws to make sure the right thing is done with those dollars. Let me give you one example, though, of a COVID-19 related expense, and it's just one small example. It's one big example, but it's small in the number of times this has happened around the country already. There's a symposium in Colorado Springs, a very large symposium based on space, the Space Symposium. The vice president has attended in the past. This is a big convention, and the cancellation of the convention this year will cost the city of Colorado Springs $5 million. It was canceled because of COVID-19. Now, I think we can make sure that the city of Colorado Springs is going to be okay. You know, we can make sure that we have COVID-19 cost-related expenses covered. We can make sure that they're not using it to...
Senator, so COVID-19 cost relates to the city of Colorado Springs. Does that mean that for all the ski resort towns, you're going to make up all of their lost tax dollars as well? For all the ski resorts that had to close?
Leland, I have no choice but to help with certain revenues. Is it going to be 100%? Is it going to be 50%? That's the date that we're going to have. I mean, look, I don't think you could. We tripped. The federal government asked people to stop going to work, to shut their businesses down, to close their restaurants. That was the government's request. And then I turn around and say, you're on your own. We're walking away.
I hear you.
That's not right.
Well, I hear you. And certainly in Colorado, there are towns that have just been devastated. They are starting to open up parts of Colorado now. Jared Polis, the governor, former member of Congress, had this to say on Neil Cavuto's show just a couple of minutes ago. Take a listen.
We're just trying to figure out, as everybody is, Neil, the sustainable phase. I mean, how do we prevent a spike in the virus that would exceed our hospital capacity? But at the same time, how do we make sure that people can earn a living and that we can have a psychologically, economically, and health sustainable phase for a period of months?
Fair to say Colorado is one of the first blue states now to open up. You had Texas, you got Florida, you had Georgia, where Brian Kemp really got a hard time for reopening. You're confident that things are going well in Colorado. Tell me why.
Look, our healthcare workers have done an incredible job. They've done the three things that we have to do. We have to make sure we're addressing the health emergency to flatten the curve and stop the spread. Our policies at the federal level are helping individuals with the assistance they need, and we're all together working to get our businesses back open so that we can snap this economy back into its full force, what it was before the health emergency. I'm working each and every day with the governor and my congressional colleagues to make sure that happens. We do it right. And in Colorado, though, there are counties that have been able to open up even more so than the rest of the state based on how well they have done in dealing with this response.
Yeah. All right, Senator, we really appreciate you being here. We want to make it clear in that soundbite that we ran, Jared Polis, the Democratic governor of Colorado, who I know you've worked closely with and across the aisle, as Colorado is truly a purple state. I understand you're heading back here now to D.C. for the Senate to go into session. We appreciate it, sir. Safe travels.
Thank you very much. Thanks, Lynn.
Good to see you as always. Dr. Deborah Birx joins Chris Wallace on Fox News Sunday tomorrow to talk about the administration's response to the coronavirus. Obviously, check your local listings for time and channel. And Howard Kurtz is going to look at the coverage of the White House coronavirus response, the allegations against former Vice President Joe Biden, and also the first White House briefing by the press secretary in an awful long time. That'll be a topic tomorrow on Media Buzz. Jillian?
I believe it was the first one in over a year, the first press conference. Meanwhile, in other news, the FDA this week issued an emergency approval of a new drug to treat COVID-19. An initial trial claims it helps patients recover faster. Steve Harrigan's in Atlanta, Georgia, with the latest. Steve?
Jillian, that was a real fast track by the FDA. They issued that emergency approval of the drug on Friday. This drug, remdesivir, shortens the time of the stay in the hospital. It can cut anywhere from 15 days down to 11 days, but officials say it is not a knockout drug.
Now we can actually ease the healthcare system as well, because if we can have the patients out of the hospital 4 days earlier without requiring all this medical care, and now we open the doors for other sick patients that are desperate to get into the hospital, especially in a situation in which the capacity is overwhelmed.
The CDC deputy director has issued a report saying the U.S. was actually slow to respond to the pandemic early on, especially in February. Two key mistakes, the number two at the CDC says, were a delay in travel alerts and also a lack of testing. Both of these contributed to a missed opportunity to slow the spread of the virus. In the meantime, the CDC has reported more than 4,000 workers in meat plants around the country have become infected by the virus. Dozens of meat plants have closed. Industry analysts say that there is a real threat to the meat supply due to those closures. And just this week, President Trump signed an executive order making it easier for those meat plants to stay open despite outbreaks of the virus inside some of those plants. Jillian, back to you.
Thanks for that, Steve. Joining us now to break all of this down is infectious disease expert and Johns Hopkins senior scholar, Dr. Amish Adalja. Dr. Adalja, thanks so much for joining us today. First question for you is about, the timing here. So the key finding of this federal trial that was released this week seems to be it helps patients recover more quickly, 11 days on average versus 15, but that it doesn't overall reduce fatality rates. Is that right?
Yes, that's what the initial readout from the study is. There's going to be more studies that are looking at different aspects of this, but just the fact that it can get people out of the hospital faster is something that we need to really value, because what this whole outbreak has been about and what the social distancing has been about is trying to preserve hospital capacity. And if you can get people out of the hospital faster, that means you have more room to take care of other people. And this does help us with hospital capacity. I think that's what's motivating the FDA's emergency use authorization and all the excitement about this drug.
Well, I was going to ask you just why those 4 days are so key, and you answered that already. So I want to ask you next about what the FDA said, and they said they were issuing this emergency approval so that hospitals can now start using the drug on patients, but only patients with severe cases. And I guess the question is, why only severe cases? If the drug works, doesn't it work on everybody?
That's a key question to ask. We need to know which patients it works best in. And each person's experience with the coronavirus is going to be a little bit different. So there are going to be people that have such mild symptoms that they wouldn't even benefit from this. And there are going to be people that are severely ill that could benefit from this. And you want to make sure that you're giving it to patients where there's maximal benefit. And the clinical trial data that they're using to make this decision, you want to try and mimic that with the patients you're using it on. So there were certain entry criteria, and you want to make sure that your patients have those similar characteristics, that they're similar to what was where this drug was studied, so that you can get that benefit. That's why the emergency use authorization is worded the way that it is.
A key distinction there. We're also getting, it seems, from public health experts and some politicians weighing in, sort of divergent opinions on whether this drug is really a miracle cure or whether it's sort of a good first step. Take a listen to Dr. Fauci on Wednesday, what he said. I'll get your reaction on the other side.
Although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus.
So somewhere in there it looks like the FDA took the leap. You know, Dr. Fauci saying it's a proof of concept, but the FDA is now approving this for use on people whose lives may depend on it.
Right. So a 31% improvement in outcome in terms of how quickly you can get people out of the hospital isn't a miracle. It's not a knockout punch. It's not changing mortality, but it is something important. You have to remember that before remdesivir, there were 0 drugs that we knew were effective against coronavirus. This is the first antiviral against a coronavirus that's been shown in a randomized controlled trial to work. So this is a big step. This proves the concept that you can develop antivirals for coronaviruses, and I think that's what Dr. Fauci was talking about. Is it a miracle drug? No, but it is going to be very helpful and an important tool as we move through this pandemic.
So it's also fair to say that this was approved now, it was fast-tracked because this is a deadly, now global pandemic, right? I mean, under normal circumstances, it wouldn't have been fast-tracked like this drug?
Right, because when a public health emergency is declared, that gives powers to the FDA to do emergency use authorizations. And we've seen many diagnostic tests, for example, approved as emergency use authorizations. Back during H1N1 in 2009, we had an antiviral approved under an emergency use authorization as well. So these are measures that we take during public health emergencies to get needed drugs to people quickly.
Thanks for laying all that out for us, Dr. Ajalja. We really appreciate your expertise and your perspective on this. We appreciate it. Thank you.
Thank you.
Well, this breaking late last night as new images reportedly show North Korean leader Kim Jong-un making his first public appearance in nearly 3 weeks. We emphasize, according to North Korean state media, he attended a ribbon-cutting ceremony for a factory. Ryan Chilcote live in London with more on this and what's being done to verify some of these pictures. Hi, Ryan.
Hi, Leland. Well, look, if the pictures are to be believed, if we can verify them, we have not done that yet ourselves, then it would appear to end the conversation, the speculation as to whether Kim Jong-un is alive or not. But it is only added to the speculation as to what is going on with his health and why Kim Jong-un disappeared in the first place for so long. Alarm bells went off right around the world in capitals when Kim Jong-un failed to show up at a celebration commemorating his grandfather's rule. His grandfather was the founder of North Korea. That was on April 15. So if there was any event that he was going to show up at, this was it. May 1, May Day, this factory opening is very important for the communist regime. Kim Jong-un would normally be at events like this. In the video, quick glance, he appears to be walking stiffly in some places, and some eyewitnesses say that he did a lot of sitting during the photo op. Generally, he looks all right, but observers also honed in on 2 facts, namely that he's driven around in parts in a golf cart around the factory, and that golf cart appears to be the very same golf cart he used back in 2014 when he resurfaced from another lengthy absence when he was thought to have been unwell. Also, if you blow the video up, you can see a mark just below his right wrist when he's waving. Now, some doctors have speculated that's from a medical procedure. Some have even said it looks like the kind of puncture doctors make to access your arteries when they're replacing a stent. It's too big, they say, to be from an IV. That, of course, is all speculation. All we know for sure is that this is the first time we're seeing him since he appeared at that Politburo meeting on April the 11th. His absence from the public eye after that prompted a lot of speculation, as you know, maybe that even his sister might take over or that he might have been incapacitated. Leland, I'm not sure if it's fair to say that Kim Jong-un gets the last laugh in all of this, but here's something to think about. Just as recently as yesterday, we were hearing unconfirmed reports that Kim Jong-un may be dead and that the government may announce that today. Well, obviously, we've moved on from that, and I think it tells you just how little we really know about what's going on in North Korea.
Very little indeed, and the president was quite cryptic yesterday about Kim Jong-un and his whereabouts. We'll wait to see if we get anything from the White House this weekend. Ryan, thanks. Jillian?
Democratic presidential candidate Joe Biden has now responded to allegations of sexual assault. We'll tell you next about his team's strategy to combat those claims, coming up next. Former Vice President Joe Biden's first interview about a sexual assault allegation from a former staffer of his is garnering swift condemnation from his critics and equally swift rebuttals from his political allies. Jackie Heinrich is tracking what some of Biden's top constituencies, women's groups and Democrats, are saying about it all. Jackie?
Well, Jillian, this morning, the lawyer who headed up President Obama's VP vetting process said that in her exhaustive vet of former Vice President Joe Biden, there was never any allegation that came up against him. And Biden has also called on the Senate to find and make public any documentation related to this allegation if it exists. Now, that answer has seemed to satisfy most Democrats in Biden's circles. Former Attorney General Eric Holder said while the allegations should be taken seriously, the denial is consistent with the Joe Biden he knows. Donna Brazil, former chair of the DNC, echoed his thoughts, as did Speaker of the House Nancy Pelosi.
I thought that he has dealt with it, complete denial, support for women, has been a champion violence against women, but that's not the purpose of this call, and I said that in my press conference yesterday.
It seems Biden's also getting a green light from some women's groups. Tina Chen, CEO of Time's Up and former Obama White House appointee, praised Biden before turning the spotlight on President Trump. Chen writes, Vice President Joe Biden sat down and directly addressed the allegation against him with the seriousness it deserves, something that the current president has never done, and added, we call for complete transparency into this claim and the multiple claims against President Donald Trump. But Republicans have not been so quick to close the book, with claims against Justice Brett Kavanaugh not far in the rearview mirror. Senator Marsha Blackburn on Fox Today.
And they feel as if the Me Too movement has actually served a purpose to make it easier for their daughters and granddaughters to say, something wrong was done to me, but then they see the Democrats using Me Too when it's convenient and dismissing it when it is not convenient.
The New York Times editorial board argued that Biden's word should not be enough on its own to dispel the cloud and said the matter should be thoroughly investigated, but they added at the same time claims against President Trump should be looked into as well. Jillian?
A lot of comparisons between how Biden's accusers are being handled and how accusers of Chief Justice Brett Kavanaugh, Supreme Court Justice Brett Kavanaugh's accusers were treated last year. Jackie, thanks for that report.
There's a battle royale over California's beaches, while local lawmakers are now turning on the governor. California's governor is facing a lot of backlash, not only from local lawmakers, but his constituents over beach closures in that state. Christina Coleman live in Huntington Beach, California, where it looks like that beach is closed as well, correct?
Yep, it is closed, Leland. And city officials here in Huntington Beach filed an injunction against the governor's order. And late yesterday, a judge denied that request. Meantime, as you can see, the beach here looks much different than it did last weekend. But there are still a handful of people here. There's surfers out and about and people biking by. So people still out here. But yesterday, a lot of people didn't hold back their frustration. Many people taking to the streets to protest. Between 2,500 to 3,000 people poured out into the streets here near PCH and Main and Huntington to protest the governor's order and push for an ease on the state's stay-at-home order. And we have been under a stay-at-home order here in California since mid-March. City leaders in Orange Counties, Dana Point and Huntington Beach City both filed injunctions to fight beach closures in Orange County, arguing the move was unconstitutional. Local lawmakers say that although images appear to show crowded, packed beaches in Orange County last weekend during this heat wave here, many people were still social distancing at the beach. The Orange County Sheriff says his department will not enforce beach closure orders by making arrests, but will instead focus on educating people and voluntary compliance. Here's the mayor of Newport Beach on Fox last night with why he says Orange County beaches should stay open.
I think what our governor did was he looked at photographs that were showing a mile of beach condensed into about a meter. It looked like everyone was on top of each other. But he should have called me. I'm the mayor of Newport Beach, and he should have asked me what we were seeing on the ground.
Governor Gavin Newsom called for the beaches to be closed after learning an estimated 80,000 people showed up to Orange County beaches last weekend. Many may have traveled to Orange County here because nearby LA County beaches are closed.
The only thing that is assured to advance the spread of the virus is thousands of people congregating together, not practicing social distancing or physical distancing.
And I don't know if you could hear there as I was speaking, there was somebody here on an intercom just announcing to people here that the beach is still closed. But again, you could see people passing by. And yesterday, Governor Gavin Newsom says that the state is actually days, not weeks away from making modification to the state's stay-at-home order. But he didn't give specific details. So we'll still have to wait and see what happens with all of that. Leland?
Very interesting, as you pointed out, that this is starting to get adjudicated by the courts, and a number of cities are fighting their own governors. Christina, we'll continue to watch it. Thanks so much.
With most schools across the country still closed, many districts now are coming up with new and innovative ways to make sure their students aren't missing out on good nutrition while they're stuck learning at home. One school district in Missouri is stepping up to make sure students still have access to breakfast and lunch. Joining us now is Kearney School District Superintendent Bill Nicely. Bill, thanks so much for joining us this afternoon. Tell us about the program and what you guys are doing for the kids, not just at your school district, but everybody under 18 in the community.
We went on spring break in mid-March and never came back. And we recognized right away that we needed an opportunity to provide meals for all of our students. And so we mobilized our transportation service, and we're a school district of about 100 square miles. And so we're a little bit suburban, and we're also rural. And we needed to reach those students that live out in the rural areas. And so with our transportation service and our volunteers, food service providers, we're rolling about 20 buses every single day containing a week's worth of food on a regular basis. We have 4,000 meals that we started off with, and we're currently up to 8,000 meals.
Are you surprised by those numbers, by the numbers of families that are now relying on you guys to get their children nutritious breakfast and lunch?
I think what has happened is our parents have said, our students are home, our children are home, we're going to go ahead and feed them. But as the pandemic has worn on, as the school closure has continued, that has created stresses in their lives. And where families may not have originally opted to participate in the food service program, they're now recognizing, hey, we could use a little bit of extra help. The meals are really good. Within that week's worth of deliveries, there's at least one hot meal delivered. And then we also have our families that have greater needs and maybe participate in a food pantry or a Harvester's Back Snack program. Our buses deliver those meals as well.
So you guys saw this problem, this hole that needed to be filled during the pandemic, getting kids who needed food. So it's really a great solution in that it's a community solution to a community-based problem, but it seems to me this program has a lot of potential for replication, not just across the school, your district and your state, but across states nationwide. Do you feel that way?
I do, and I think in some capacity, most school districts are providing food to the extent that they can. This is a great community. I'm so proud of our staff and our community who have stepped up and said, we want to volunteer, we want to assist in this effort. Our paraprofessionals, our aides are riding in the buses, they're getting off with their masks on and delivering meals to these homes. It's a great effort.
We only have a couple seconds left, but what's your top piece of advice for other school districts looking to replicate this program? The one thing you've learned that's key.
If you think that your employees won't step up and participate to help kids, they will. They absolutely will every time.
Well, it's a wonderful lesson. It's a wonderful program that you're running. We wish you all the best moving forward, and we will stay in touch with you. Thanks so much, Bill Nicely.
Thank you.
Leland?
They're doing great work there. We're going to also introduce you to a local farmer